Welcome everyone back to our coverage of the World Health Assembly. I'm Raj Kumar, the President, Editor-in-Chief of Devex, and really honored to be joined by Pascal Soriot, who is the CEO of AstraZeneca. I think everybody knows you and knows AstraZeneca. You've been at the center of this effort to get a vaccine for the coronavirus pandemic for COVID-19 and get it out to everyone in the world. So maybe we could just start with that, Pascal, because I know everyone here at the World Health Assembly is asking this question. How is it going? How do you assess the overall global effort to get a vaccine in everyone's arm around the world?
Well, Raj, first of all, thank you for having me. It's really a pleasure to be here with you and talk to this World Assembly. I think overall as an industry, we're making very good progress. Collectively, we are covering the entire world, I will say. And in our case at AstraZeneca, we've been mostly covering Europe and the rest of the world, and in particular, the low middle income countries. So far, we have actually released more than 400 million doses. And quite frankly, this number is 1 week old, so we are probably more around the 450 by now. And we have delivered those to 160 countries. And we are going very well. Some regions, of course, have more challenges than others. We have a global supply chain, and it's going very well in some parts of the world and more challenging in other parts. But overall, 400 million doses of vaccine is a huge effort. And in India, for instance, 90% of the vaccinations are taking place with our vaccine through our partner, Serum Institute.
What do you think can be done? Speaking of India, what do you think can be done? India is in such a crisis that they have said, understandably in some ways, we're holding back the AstraZeneca vaccine for use domestically. But of course, COVAX and many countries in low and middle income countries in Africa and elsewhere were depending on that vaccine supply. What can be done to help address this so that we don't end up with some countries heavily vaccinated and others waiting a year or longer?
Yes, it's a great question. Actually, the plan actually was that we would supply COVAX together with Serum Institute, and AstraZeneca, we have our own supply chain supplying COVAX, and then Serum Institute was also going to contribute. But nobody expected this surge in the pandemic in India. And as a result, and we can understand it, of course, as a result, the government of India decided to prioritize supply to Indian citizens. So we are not able to export out of India. Now, the good news is our vaccine is making a big difference in India. But of course, the not so good news is we are short in supply to COVAX and the other countries. So what we're trying to do is increase supply from elsewhere, but it's very difficult because our supply chains are very stretched already. What we are hoping is that some countries that are getting to a good level of vaccination of their populations are going to donate. And you've heard that the US government is talking about donating some of their doses of vaccines. The European community is also considering it. So we are hoping that a number of countries will be able to donate to bridge, because at some point India will be able to restart exporting, and our own supply chains around the world will start kicking in and ramping up. So it's a question of bridging between now and then. And of course, what people need is a vaccine today, and that creates a lot of challenges.
It does. And what are some of the blockers that you are most worried about? I know IP has been a big question, and whether if that were relaxed, would that actually help speed up the process? There's, of course, other issues like cold chain, health workforce, especially when you're thinking of low and middle income countries. There are examples of countries that had vaccines and were not able to actually deliver them. What are the main things you're focused on in terms of getting this vaccination rate up?
Well, IP is really not an issue in our case because we decided up front that we would supply the vaccine at no profit. So, we're basically supplying at cost.
But isn't it an issue in terms of other manufacturing sites being able to take it up and produce it on their own?
Yeah, so you have the price and you have the capacity. It's a good question, Raj, and I was getting to it. So then the capacity question. We again tried our model is as close as it can get to the no IP model. We have 25 sites around the world. We're partnering with a large number of partners around the world, and we've taught them, we've trained them in the technology. We've done what is called a technology transfer. We really could not go beyond that. Our priority now has to be to improve productivity, output at each of those sites. We've had issues with yield, which is the number of doses of vaccines you get out of 1 liter of product in the bioreactors. And the key for us is to really increase the yield so we can get more out of a bioreactor. We could not increase the number of sites. First of all, we've really talked to all the large capacity manufacturers in the world. And secondly, even if there were new ones, we really would not have the capacity from a people viewpoint. We would not have the engineers to train them on the technology. Our engineers are working 24/7 on trying to improve the output, the yield, the productivity of the ongoing sites.
And what about some of the other blockers, in terms of health workforce, train people to deliver it, or cold chain? What are some of the other things you're thinking about and focused on?
This is a great question. In fact, in our case, really, we've had two issues. Cold chain is not an issue. It's been an issue. It's an issue for other vaccines, and those manufacturers are solving the problem in many places. The issue for us has been more a question of training the staff with our partners, because as you can imagine, you don't go from 0 to or a few 100 million doses of vaccines to billions. So many of our partners have had to recruit staff, and those staff have had to be trained, which is what we did last year. But making vaccines is complicated, and that has had an impact on the yields we get out of these bioreactors. So our focus has been to train people, make sure they understand the process better and better, and we're making progress. The yield is increasing. So it's been more a question of the staff, the recruitment, the training. And in some cases, mostly with Serum Institute, it has been about sourcing material and sourcing parts of equipment like filters that go into the production, and some of those coming from the US, and there was not enough. And again, our partner Serum Institute is working hard to solve this so they can further increase their capacity.
I mean, you famously stood up because of this emergency and created this new vaccine initiative. But AstraZeneca wasn't in this business before. Do you think this is a one-off? Will you see through this emergency and then that's it? Or is AstraZeneca going to become a player in the vaccine business?
We haven't decided this, Raj. I mean, as you can imagine, we are 100% focused on delivering the doses that people need around the world, in Europe, of course, but elsewhere in the world, the low middle income countries, and also the upper middle income countries. I mean, Brazil, we have a partnership with Fiocruz, and it's going very well. As I said, some regions are doing very well, and other regions are facing challenges. So our focus is really getting everybody up and running, improving yields, training staff, working very closely with our partners. And we'll turn our attention to the next steps when we have indeed delivered this vaccine to as many people as possible around the world.
Yeah, I ask you that in part, Pascal, because a big conversation point at this year's World Health Assembly is the future of the vaccine supply chain delivery system. There are many people calling for manufacturing to move, for example, to countries in continental Africa. How do you see the broader questions? You talked about IP not being a blocker for today's emergency right now, but when you think about the future of this industry and the way vaccines are manufactured and developed, what do you see going forward?
Well, I think that what this crisis has shown is that vaccines are not only a scientific challenge, they're mostly an industrial challenge. If you think about it, a year ago, I mean, I'm sure you'll remember, everybody was talking about 120, 130 vaccines, in development in various places. And today there's 4, 5, 6 maximum. And of course, some haven't worked for scientific reasons, but mostly the issue has been capacity, manufacturing, scale, right? So I think for the future, it's really a question of scale. And what we've tried to do is establish supply chains on a regional basis. So we have one in Brazil with Fiocruz, as I mentioned. We have one in Latin America. We have one in South Asia. We have one in India, of course. We have one in China, one in Japan, one in Russia, Europe, US. So we've really tried to regionalize those supply chains to be able to cater to the needs of those countries on a regional basis. I think the question for the future is really how do we set up, we as a society, countries, regions, how do they set up capacity that can be tapped into very quickly? And easy to say, not so easy to do, right? Because Of course, we don't. We all hope we won't have another pandemic like this for a long time. And so, if you don't have one for a long time, then in the meantime, what do we do with this idle capacity that someone has to pay for? And so, this is one of the things that I guess governments and organizations around the world will have to think through. How do we maintain a capacity that can be tapped into very quickly to scale up manufacturing?
I think part of the conversation is whether that capacity can be used for routine vaccinations, and like the typical vaccines a child gets when they're born, and then can also be repurposed in an emergency. I don't know if you think that's practical based on what you've
Well,
seen.
the big difference is if you think about it in terms of the current vaccines, we're talking about hundreds of millions of doses a year. And here with a pandemic like COVID, we're talking about billions. So if you try to make, I don't know, for the lack of a better word, current vaccines or common vaccines in this large capacity, you will make those vaccines very expensive. And of course, vaccines like those you supply to the low middle income countries, they have to be low-cost vaccines. And to be low-cost, you have to maximize the utilization of your capacity. So there's a tension between keeping the current vaccines at a low price by maximizing the use of the capacity you have versus keeping capacity ready to be used for a pandemic. At the end of the day, it's a question of money, right? I mean, nothing more, right? And but it is an issue that has to be tackled.
Yeah, money and who pays for it. I guess
Exactly.
maybe, it's so interesting to hear your thoughts on this. You've had an incredible, busy, intense year right at the center of this crisis. What are some of the lessons that you've learned from it when you look ahead now and you think about where we want to go in terms of strengthening health systems? What are some of the big lessons you take away from this pandemic, which we're still very much in, but the point that we're at now?
Yeah, I mean, I think first of all, as it relates to vaccine, as I said, capacity, manufacturing capacity, everybody's focused on science. And of course, the mRNA vaccines are new technology that have emerged. So science is important, there's no question. But it's really a question of industrial capacity. So that's one issue. And in terms of healthcare system as a whole, I think, again, we need to think a little bit about redundant capacity in some cases, but mostly we need to think about flexibility and agility of those systems and the use of digital, so that you more and more look at how can you diagnose and treat patients outside of the hospitals, reduce the visits to hospitals so you can actually have better use of the capacity that you have in the hospitals. And I think digital here can really play a big role in the future to treat a variety of diseases and then enable the treatment of those people outside the hospital. In fact, one of the big tragedy in this COVID crisis is, of course, COVID and the deaths related to COVID itself, but then they have an indirect impact of COVID on other diseases. We've seen a substantial drop of 20-30% in the diagnosis of cancers. We've seen a drop in the number of heart attacks being treated in hospitals. Why? Because people were worried about going to hospitals, and the system itself was not able to process people who had symptoms and required a scan or something that would enable diagnosis of cancer. So we need to find new ways to manage those people and those cases better in the future in case of a pandemic.
It's a great point. When you think of the lockdowns and all the economic effects that it had on people, their livelihood, so much of it was to protect the limited capacity in hospitals. If you can get that kind of healthcare treatment to be digital, it creates more flexibility and maybe really enhances the opportunity to get through a pandemic without all of these negative side effects. Pascal Soriot, it's been such an honor to get time with you today and to hear your voice as we cover the World Health Assembly and think about these big picture questions for the future. Thank you so much for what you and your colleagues are doing at AstraZeneca, and thanks for your time.
Thank you, Raj.